Next, speaking is Shawn Soumilas. She'll be talking about improving birth outcomes and using a comprehensive approach to preconception health screening.
Hello, my name is Shawn Soumilas, and today I'm going to share my ASU Masters in Healthcare Innovation capstone with you, Improving Birth Outcomes, a Comprehensive Approach to Preconception Health Screening. The U.S. has some of the worst maternal, fetal, and infant mortality rates of any developed nation. Despite advancements in prenatal care, the prevalence of these adverse outcomes remains disproportionately high, particularly among certain demographic groups, including women of color and those from socially disadvantaged backgrounds. These disparities highlight the urgent need for innovative approaches to improve maternal, fetal, and infant health outcomes. Here is the latest data from the CDC. The 2021 maternal mortality rate was 32.9 deaths per 100,000 live births, and the highest it's been since 1965. The 2022 infant mortality rate was 5.6 deaths per 1,000 live births, equating to 20,000 babies not seeing their first birthday. And in 2020, more than 21,000 babies were stillborn in our country. Before moving forward, I'd like to acknowledge that research can be conflicting. However, there is enough evidence to argue that preconception health screening should be implemented as a preventative standard of practice to improve birth outcomes in our country. According to the CDC, 4 out of 5 pregnancy-related deaths are preventable. Also, evidence indicates that at least 25% of the stillbirths in the U.S. are preventable. And per the March of Dimes, prematurity is a leading cause of infant death, and almost 75% are preventable. Cardiovascular issues, thrombophilia events, and hypertensive disorders remain some of the leading causes of maternal death. In 2020, the economic burden of maternal mortality on its own cost the U.S. $10.4 billion. Maternal inherited thrombophilia is a group of genetic disorders that cause blood to clot abnormally and is associated with an increased risk of recurrent pregnancy loss, fetal growth restriction, late miscarriages, preeclampsia, maternal death, and stillbirth. While universal thyroid screening continues to be a key debate in obstetrics, there is growing evidence indicating that subclinical thyroid disease is associated with adverse pregnancy outcomes. A 2021 study of over 50,000 women determined that subclinical thyroid dysfunction before conception was associated with an increased risk of pregnancy complications. Autoimmune diseases are associated with a high incidence of adverse pregnancy outcomes ranging from prematurity, fetal growth restriction, low birth rate, maternal death, and infant death. In the words of Benjamin Franklin, an ounce of prevention is worth a pound of cure. It wasn't until after my son's stillbirth and subsequent severe maternal morbidity that I discovered I have an inherited clotting disorder along with previously undiagnosed autoimmune and thyroid disease. Because I look healthy, my concerns during pregnancy were often dismissed and no further testing was conducted. Currently, there is no universal screening in the U.S. to identify individuals at risk for serious complications until it's often too late. Current preconception care initiatives in the U.S. lacks comprehensive screening protocols tailored to individual risk factors, resulting in missed opportunities for intervention and prevention. In 2006, the CDC released a report on how to improve preconception health in the U.S., but these recommendations have not gained traction or created the systemic change needed. In response to the CDC report, there was a call to make preconception healthcare a part of routine family medicine, which could facilitate a continuity of care and promote health equity by addressing disparities in access to preventative services. The preconception health screening panel would include assessments for inherited thrombophilia, thyroid function, autoimmune activity, as well as considerations for lifestyle factors and social determinants of health. Through the adoption of this thorough preconception health screening bundle, healthcare providers can proactively identify individuals with elevated risk for adverse pregnancy outcomes early on. This enables the implementation of targeted interventions, personalized counseling, and customized care plans to optimize maternal and fetal health. A quick and innovative solution would be to leverage existing technology to develop a direct-to-consumer preconception health screening kit for use at home. With 65 million people of childbearing age in the U.S., this home-based test could offer people valuable knowledge leading to a healthy pregnancy. Ultimately, in order to ensure equitable access to preconception health screening for all individuals giving birth in the U.S., a multifaceted approach is required to truly effect systemic change. This would encompass a public awareness initiative focusing on preconception health, educational programs for healthcare providers, backing from prominent organizations such as the March of Dimes, and the enactment of federal legislation to drive policy reform and secure funding. Next, I'm going to talk briefly about two challenges and how they can be addressed: passage of federal legislation and gaining payer support. Established in 1970, the Title X Family Planning Program is the sole federal program in the U.S. specifically designed to address family planning and related preventative health services, with the program serving 1.7 million people. While Title X includes provisions for preventative and preconception health services, there is potential for improvement by amending and expanding the language to better define and encompass these essential services like preconception health screening. We know there are proven advocacy strategies that have demonstrated effectiveness, and by leveraging these strategies, I firmly believe we can elevate discussions on preconception health in our country, ultimately leading to policy change and tangible improvements in birth outcomes for American families. I had the opportunity to directly talk with a CMO from a prominent health insurance company in the U.S. This individual, a former OBGYN, expressed enthusiasm regarding the screening's potential as a valuable diagnostic tool for providers. However, there was apprehension from a payer standpoint due to upfront cost. To address this concern, presenting accurate data, emphasizing evidence-based strategies, and offering a cost-benefit analysis showcasing potential healthcare cost savings could mitigate reluctance. Preconception health screening holds promise in reducing healthcare expenses associated with maternal mortality, stillbirth, preterm birth, and NICU stays. Maternal, fetal, and infant mortality represents a devastating occurrence with profound repercussions for families and communities alike. Preconception health screening stands as a comprehensive and invaluable resource poised to drive systemic enhancements for pregnancy outcomes across the U.S. Thank you for your time today, and I am open to any feedback or questions that you may have.